Alright, so we're back to our orthopedic series. I was just trying to look at some one or two issues. Alright, so the next one which we are looking at is what is known as the amyoplasia. Amyoplasia. Alright, so this is amyoplasia right here before our screens. Alright, and of course you could see that it has to do with muscle and bone issues. Alright, this is another baby born with the amyoplasia, and this shows how the baby has been growing with the condition. So it's just a common form of what? Arthrogryposis multiplex congenita, which we have looked at several times. Okay, so it's actually a group of condition. That's the arthrogryposis multiplex congenita. It's not one condition, right? It's a group of issues. So they cause what? Joint contractures, right, at birth. Okay, so what is amyoplasia? It's a congenital disorder. Is marked by what? Your muscles are not developing fully, all right, and your joints are also stiff in at least two parts of the body. All right, so muscle tissue is often replaced by fibrous or fatty tissues. Yes, so the person now have weak muscles, and the range at which they could actually move those muscles is kind of like limited, so it typically it will affect the forelimbs. Like you see this person, this leg is affected, this is affected, this hand is affected, this other hand is also affected. So causes and mechanism is thought to result from fetal akinesia. So the baby was not moving well when they were in the stomach. Okay, so they call that fetal akinesia. Kinesia is moving, is what? Absence of movement or reduced movement. So this immobility leads to what? Extra connective tissue forming around joints, causing them to become fixed. So no single genetic mutation is what? Linked to it. You understand? So clinical features is such a person, they have what? Extended or flexed elbows, all right, then club foot or other lower limb issues. Okay, you can see this baby has a lot of problems in their lower limb. Okay, and if it's club foot, okay, obviously, then skin dimpling over joints, then possibly they have a midline forehead, hemangioma. That's problems with bleedings in the head. So diagnosis is, of course, is something you can see it, but before the baby is born, you might have suspected this, all right, under the ultrasound. They confirm it at birth, where you are now seeing the physical issues and all. Then you do imaging just to look at the muscles that are affected, look at the bones that are affected. Management: the person needs orthopedic care, physiotherapy care, occupational care, surgical interventions to improve joint mobilities, and all of that. So apart from the physical issues in the muscles and the joints, such individuals with this condition, they have normal intelligence, all right? They don't have problems with reasoning, understanding, speaking, and all of that.